Time to take our coronavirus questions to the experts, and joining us tonight is Dr. Brian Hollenbeck, the Chief of Infectious Disease at New England Baptist Hospital. Dr. Hollenbeck, thanks for your time today.
Thank you for having me.
All right, so the U.S. today surpassed 6 million cases of COVID-19. It took 22 days to go from 5 million to 6 million. The previous million, so 4 to 5 million, was 17 days, and before that, 15 days. So the period is getting longer, and should we take that as a sign that maybe, hopefully, things are stabilizing?
Yeah, I think we can. Yeah, it is taking longer to increase these numbers by the same amount. And so that is a positive sign. 1 million cases is a lot of cases, and so we're still seeing room for improvement, for sure. But it is a good sign that it's taking longer to get there.
All right, hundreds of people protested yesterday over the weekend against requiring flu vaccines for school children this year, which the governor has now required. From your perspective, why is requiring the vaccine so important, and what kind of advantage does it give when a flu season collides with a pandemic?
Yeah, so the flu vaccine's been required for healthcare workers for a long time, so not a completely new thing to require it within Massachusetts. We do know that flu and coronavirus overlap quite a bit in terms of what the symptoms might look like. And as we head into the fall and winter, it's going to be difficult to distinguish between people with flu or people with coronavirus. And depending on availability of testing, that could really limit the ability to make diagnoses of flu or coronavirus, and therefore allow both diseases to spread. Both diseases are capable of causing a lot of hospitalizations and a lot of morbidity, a lot of death. And so everything that we can do to prevent both diseases will be really important this year. So I fully support what the DPH has decided to do here.
All right, a new study from the CDC looked at frontline healthcare workers who care for COVID-19 patients, and they found that 6% of those surveyed had antibodies to the virus, which indicates they'd been infected at some point in time. But nearly 70% of them had never been diagnosed. So what types of precautions are in place at hospitals right now? Is it enough? Is there enough testing of these frontline workers and, of course, the patients in hospitals?
Yeah, that was a really interesting and good study that came out from the CDC. It looks at 13 different hospitals across the country, mostly academic medical centers. And actually within Boston, Beth Israel Deaconess Medical Center is one of those 13 hospitals that's in that study. And what's interesting when you look at that study is that it's true. There are a lot of people that apparently had coronavirus but never had symptoms, or had testing with symptoms but weren't diagnosed. But that's also what we know about the general population. So that's what we know to be true, of everybody anyway. So what's really interesting within Beth Israel is that you see actually a lower percentage of healthcare workers with prior coronavirus than you do within the general Boston population, indicating that what we're doing within hospitals seems to be making a difference. So that's good. So what would you expect if you're coming into a hospital? We're testing a lot of people with or without symptoms. So if you're being hospitalized in the Boston area, you likely would end up with a test for coronavirus. You definitely will be asked about symptoms of coronavirus or exposure. And then you'll see that everybody in the hospital is wearing a mask, just a typical kind of surgical mask. And you may have other masks for certain scenarios. And you also see that a lot of people in different hospitals and offices are wearing face shields, which we know can prevent disease as well, prevent disease spread. You'll also be, I'm sure, asked to wear a mask. So what we know is that really the masks are the thing that seem to be making the biggest impact in terms of preventing transmission within the hospital.
All right, Dr. Brian Hollenbeck with New England Baptist, Chief of Infectious Diseases. Dr. Hollenbeck, thanks again for your time.
Thank you very much.